Good afternoon, friends and science supporters. My name is Kirsten Straughan. I'm a registered dietitian nutritionist and a clinical assistant professor at the University of Illinois at Chicago. I am here today because science matters, and right now, nutrition science is being sidelined. For over 20 years, I have taught my students how the Dietary Guidelines for Americans is a great example of science informing policy. These guidelines were built on the work of a transparent, independent, scientific advisory committee that carefully reviewed the totality of evidence. The guidelines were not perfect, but they reflected scientific consensus. Now, under RFK Jr.'s oversight, that scientific process has been dismissed. The advisory committee's report was set aside, and individuals representing the beef, dairy, and food industries were elevated instead. When you replace scientists with industry voices, you do not get clarity, you get chaos. Before RFK Jr., the guidelines considered the barriers that people face to healthy eating, such as limited access to healthy food and strategies for healthy eating on a budget. The new guidelines have shifted to a message of individual responsibility. Health is framed as a personal choice in a Super Bowl ad. And if you cannot meet the recommendations, it becomes a moral failing. But scientists who study how to help people improve their diets know better. We know that access, affordability, education, and environment shape dietary patterns far more than personal willpower. The contradictions are staggering at RFK Jr.'s Department of Health and Human Services. Have whole milk, eat a large steak and beef tallow, but still maintain less than 10% of your calories from saturated fat. Chaos. Double your protein intake without any scientific evidence to justify it. Chaos. Eliminate alcohol serving size recommendations, even though growing evidence links alcohol consumption to many common cancers. Chaos. This is what happens when scientific consensus is ignored. We end up with essential research funding being canceled, and nutrition science is already challenging. It is difficult to conduct long-term randomized controlled trials in free-living humans, which is exactly why we need more funding for rigorous research and not less. And the contradictions extend beyond the guidelines. RFK Jr. promised that toxic chemicals would be removed from the food supply, yet the Trump administration is increasing the use of glyphosate, a pesticide linked to cancer. The Trump administration has reapproved dicamba, a pesticide linked to damage in farmland and wildlife. We heard promises to remove mercury from fish, yet the administration is rolling back regulations on coal plants, the largest source of mercury pollution. And research into PFAS, the so-called forever chemicals that contaminate soil, water, livestock, and us, humans, has been halted. We were told ultra-processed foods would be addressed, but instead of taking on powerful food companies, the focus has shifted to seed oils and food dyes. And at the same time, the Food Insecurity Survey, which has been monitoring American families for over 30 years, has been eliminated. This is making it easier to ignore hunger and justify cuts in SNAP funding. MyPlate.gov, which helped families translate science into affordable, practical meals, has been removed. SNAP Ed, a proven nutrition education program that improves health outcomes and reduces healthcare costs, has been eliminated. And let me be clear, videos of creepy celebrities sitting in a sauna wearing jeans while drinking raw whole milk That will not make America healthy. Registered dietitian, nutritionists, and public health experts are all in on reducing ultra-processed foods. We have been working towards healthier food systems for decades, but empowering industries that degrade our environment, that will not make America healthy. Cutting evidence-based nutrition education programs will not make America healthy. Dismissing scientific advisory committees will not make America healthy. And slashing research funding while promoting chaos, that also will not make America healthy. If we want a healthier nation, we must promote scientific integrity, fund rigorous research, prioritize equity, and keep industry influence out of our dietary policy. Stand up for science, stand up for evidence, and stand up for the health of our communities. Thank you very much.